Empowerment Through Knowledge and Serena Stone present the Tequila Drinker's Guide to Health and Wellness radio show with your host, medical Qigong author, practitioner, and educator, Serena Stone, featuring the director of the Universal Healing Tao Medical Qigong System, Master Montauk Chia.
Welcome back, listeners. This is Serena, and for the next few minutes here, we're going to be talking to the infamous Jay Moon. Jay is a cannabis activist. That's really a serious understatement. Hi, Jay.
Good afternoon.
Hi. Where are we today?
We're in Malibu, California, next to the ocean. We're at a local dispensary here that specializes in cannabinoid supplement medicine. They focus on patient healing as opposed to what many dispensaries do and just
focus on getting high.
Yeah, and there's nothing wrong with that, but
that is a very different area. And yeah. Listeners, I want you to get that we're going to do about 3 interviews with Jay. And look, we have no judgment on those who use recreationally. That's terrific. It's just not what we're going to be talking about. If you've got friends or family who are ill, dealing with cancer, dealing with diabetes, high blood pressure, inflammatory issues, autoimmune issues, you want to keep track of this podcast because
restless leg syndrome,
oh gosh, yeah, my
seizures, irritable bowel syndrome, psoriasis.
The pictures of psoriasis are going to be like burned into my head forever. So, folks, listeners, you want to take note of this podcast and you want to alert your friends and family. We're going to get some information from Jay Moon over the next few weeks that's invaluable. At least a lot of us feel that it is. All right, so Jay, you and I, first of all, let's just start over again because you were with us about 1.5 years ago. Mm-hmm. What do you call yourself? What do you do?
I'm a cannabis practitioner. That's I provide a cannabinoid supplement designed to treat symptoms or disease, and we approach it in to correctly define what we do is simply a nutritional supplement. Our body makes cannabinoids. We have a cannabinoid receptor present on every single cell in our body, and just think about that for a moment. That's huge. I mean, I don't know how.
So you're saying that by design,
yes,
the human body has a need.
Every
cannabinoids.
Cell.
Right. Well, it's just like we were talking earlier, you need vitamin C. If you don't eat the vitamin C and get your supplement, right, by eating an orange with the bioflavonoids on it, so it's bioavailable, we're definitely going to talk about that.
Yes.
Then you're going to get scurvy. So if you have a cannabinoid, did I just say it right?
You said it right.
Cannabinoid system, and we're not producing our own cannabinoids, or at least enough of them to stay healthy, then it would just stand to reason this is a nutritional supplement for health and wellness. We're gonna go real deep into what that means, but just go simple. If you don't get vitamin C, I mean, eventually you lose your teeth and all this stuff starts falling apart. So, this is a nutritional supplement that most of us may need at some point.
It is probably the single most important nutritional supplement that a human being, or actually any mammal with a backbone, can take. So dogs, cats, our pets benefit from it.
So I want to talk about, at some point in the next 3 interviews, I do want to talk about, just taking this for maintenance and prevention, and we'll talk about that. But listeners, Jay has seen, I'm going to say Jay has seen some shit. Okay? He's seen cancer. He's seen it go into remission. So we decided that, and that's by using this nutritional supplements. By the way, you're not going to self-diagnose any more than you're going to self-dose. Okay, we will definitely talk about that. So Jay is an expert. The people that he works with are experts. So don't just go out there and start eating plants and things like that. You do need some support and some education.
You can't go wrong doing that with cannabis, but you're not going to achieve the desired dosing level.
If you've got cancer, you work with an expert to get rid of it. So we're going to start with the basic of basics, and we talked about, you used the word responsibility.
Yes.
So what are
endocannabinoid, and we'll use the acronym from this point forward, ECS, endocannabinoid system.
Okay.
So the ECS has many areas of responsibility within the human body. First and foremost is cell health and cell death. Like I said in the beginning, when every single cell has a cannabinoid receptor on it, protein, glucose, cannabinoid, mitochondria, cell wall, cells are small, and they're not, each component is vital. And back in the 1980s, when researchers discovered a cannabinoid receptor present on every cell, they hypothesized that there must be a cannabinoid system. So the research continued throughout the decade, and lo and behold, they were right. They found cannabinoid receptors heavily concentrated in our immune system, our nervous system, our brain, every single cell in our body. Our body makes cannabinoids, obviously a lot of them if there's a receptor on every single cell.
Right.
Those cannabinoids travel through the bloodstream, and when they attach to the receptor, they execute a command. Now, dependent upon the condition of that cell, that will determine the command that they issue. If the cell is diseased, damaged, broken, mutant, cancer, aged out, it will secrete an enzyme that kills the mitochondria, and that cell dies. Quite simply, that's how it's effective against disease, cancer. When you heal on a cellular level, it's hard not to heal just about anything in its way.
Exactly. As a lot of our listeners know, my area is an area of Chinese medicine, and it's we spent our time together today. It just blows my mind that most of what you're saying actually goes back to this way of nature, the Tao, the way of nature, and this belief, or I'm going to go beyond that and actually say the knowledge that when we get our body balanced and healthy and all the organs and glands are functioning correctly,
it heals itself.
It heals itself. The body heals itself, and it's amazing to actually watch that go down in some of our bodies. And then, of course, then there's another point of view, and I won't name it, Western medicine, where we're treating the symptom, and we're just getting sicker and sicker. So to me, this is natural medicine, acknowledging that we do have this system in our body, and sometimes we're producing enough, and to go into to dock into those cells and keep that system healthy. And sometimes, it's just like with vitamin C, like I said before, sometimes we need a nutritional supplement. If I'm really sick, like high blood pressure, horrible nerve disorders, rogue cells, or we say cancer, then it would stand to reason that I would need supplementation, and we're going to call that medicine, to get better.
Yeah, well,
But not forever, do we? Because a lot of times, let's just say, we've got cancer, and they're telling us, you are going to be on this medicine for a couple years. After that, then you're going to be on this stuff for the rest of your life, blah, blah, blah. That is not what I'm hearing from you. I'm hearing certain diseases are going into remission. And then, of course, there's do you have healthy thoughts? Do you have a healthy lifestyle? And maybe you need your nutritional supplements here and there. But I'm not hearing, nope, you got to take your booty bullets, and folks will tell you more about that for the rest of your life.
Dr. Ethan Russo talks about a cannabinoid deficiency as a cause of many disease.
Mm-hmm.
Dr. Raphael Mashula, who discovered that THC and CBD are cannabinoids back in the early 60s and outlined the CB1, CB2 receptors. These are true genius pioneers in our field, and if Dr. Ethan Russo is correct, and I believe they are correct, that a deficiency is a cause of disease, then that's a supplement that you would need to take for the rest of your life. And I have seen it go both ways. I have seen cancer patients that have done a Rick Simpson protocol, and a Rick Simpson protocol is pretty simple. It is a minimum of 30 grams a month, starting dose, and you can go as high as 60 or 90 grams a month.
Yeah.
I mean,
is that to cure an
cancer?
ailment?
Yeah.
Okay.
Or any number of diseases, for that matter, and the elimination of sugar from one's diet. So what we,
oh God, don't even get me started.
Yeah, and what we recommend with someone who's and obviously talk to a professional nutritionist, but a good start is high-fat keto. That's just a good place to start.
Yep.
Keep it simple. Clean proteins. Don't combine 6 different items on the plate. And stick to green vegetables. If you got to do a little fruit, make sure it's a blueberry or a blackberry, because they contain more fiber than they do sugar. So it's a win. If you go with green vegetables and stay away from sugary stuff like corn, and your fruit you keep in the berry department.
I was going to say berries and watermelon are basically what's going to show up as okay for that one. And
that's it.
This is very new for a lot of our listeners. So calm down, folks. Look up keto. Look up what's that other one? Paleo.
Paleo is if you're not if you're not in a cancer bout. Look, we should eat like our caveman ancestors ate. I mean, we had I don't know how many. 500,000 generations of human beings, and it's only recently that we've gone to this carb fest and this pre-packaged stuff, okay, and you wonder why everyone's sick and obese. It's not a puzzle. Our grandparents were not sick and were not obese.
Nope.
In the neighborhood I grew up in, one had cancer.
And it was a big deal.
It was we all knew about it because we were all played in everybody's house. We all knew each other. I mean, it was just one big neighborhood family. And today the numbers are half the men and a third of women will be diagnosed with cancer.
It's funny that you're saying this. I go to a natural doctor. She's a kinesiologist. That's how she tests the systems of my body. I went in there on Monday and she said, "What did you do?" And I said, "I found pasta that was made with only pea flour," right? And she said, "I've told you, if they dehydrate it and then, leave it in a box for a while, it's dead. And then you rehydrate it. And how much of pasta did you eat?" I said, "The whole box." She's like, "I can't even help you today. You are so inflamed. Now you got to go and, chill out for a week." And she was right. 5 days later, after eating, it was not just pasta. Actually, I had a little slice of birthday cake. Okay, fine.
Look, if you're going to fall off the wagon, you've got to make it count.
Oh, Jay, I had a great day.
You have to make it count.
I had so much fun, but she was right. It's her job to point things out, and it's your job to point things out that 5 days later, I still had inflammation. And folks, we talked about inflammation with Jay a year and a half ago. I'm going to ask Jay to say some words on that again, and how the medicines that he's producing now could help us with that. Folks, they call it the silent killer for a reason. I'm not going to get into it. I'm actually going to let Jay do it. But actually, it made me laugh because, I'm just now starting to get rid of the water that my body held as a result of having a slice of birthday cake and a box of pasta. Okay, and and that was really I didn't have alcohol. I didn't do anything else. White flour, white sugar, some dairy that wasn't raw, and a box of pasta. And not a week, but 5 days later, I still felt like crap. My digestion wasn't moving like it was prior to that. It's pretty crazy. So you had mentioned that you do have knowledge about inflammation, and since we're talking about areas of responsibility now for this new medicine, tell us what you know about inflammation. What does it mean, and why do our listeners care? And then finish with, how does this medicine that you've been researching for so many years play into that?
I'll just say this. CBD is the single most effective
anti-inflammatory
on the planet. It is a virtual plant copy of a phytocannabinoid, phyto meaning a plant cannabinoid, that is virtually identical to the cannabinoid that our body manufactures internally.
Okay, now you just said CBD.
Yes.
That's different than THC.
Yes. There are some, when I started in this nearly 6 years ago, there were 114 known chemical interactions, what we call the entourage effect between cannabinoids and terpenes on this plant.
Okay.
Today, science has identified over 400.
Yikes.
Yeah, it's just a few years, okay?
Jeez. Okay.
Yeah, what we don't know about this plant can fill the Library of Congress, but what we do know about it is indexed in the National Library of Medicine, and there are thousands and thousands of studies on this.
Okay. Let's go back to inflammation. What is it, and why do they care?
Inflammation is the precursor to pretty much all disease. It is responsible for that pain that you feel in your arthritic joints. Mm-hmm. It is, as you so eloquently pointed out, the silent killer. Yeah. It's our body's manifestation of stress. It is reduced or eliminated by CBD. CBD, normally you've probably seen or heard or maybe personally experienced. How many times? Oh, inflammation, the doctor says, and what do they do? They prescribe a steroid.
Yeah, my favorite is the word fibromyalgia, which basically means you have so much water in your fascia, it literally hurts. And what do? They give you a drug so you can't feel the pain. I'm like, yeah, that's going to help the root. Ugh.
That masks the symptom and allows you to do more damage.
Yep. And then they take a drug that makes them more toxic, so their fibromyalgia is worse when the pain meds wear off.
10 years ago, they were telling people with fibromyalgia, it's all in your head, you're crazy.
Yeah, that's true.
So...
That is true.
So...
I guess we've come that far. We should probably not get too negative.
No, look, I'm an integrative guy.
Yeah.
I mean, look, when...
What does that mean, you're an integrative guy?
Eastern, Western, holistic.
Okay.
All modalities have viable, worthwhile tools.
Okay.
To think that because I'm a holistic guy, to think that Western medicine doesn't bring beautiful, wonderful tools to the table is crazy. I mean, I do not prescribe to painkillers. I know that CBD and THC do a much better job. Okay,
I'm going to actually stop you right there because across the country, and we're in the United States, folks. As we said, we're in Malibu. Across the country, we're seeing CBD stuff everywhere. Apparently, that's legal.
Oh, that's kind of crazy. Okay.
Yeah, so, and is that real medicine? How do our folks know how to use it? If it's any good? How the heck? What's out there?
It's wild, wild west right now. What the best medicine for people to purchase is whole plant, terpene-rich, full spectrum cannabis oil, hemp oil, Rick Simpson oil. They all of those names describe this medicine. It's like, it's the same thing if you, a lavender extract. If you extract lavender from a plant, that's how we extract oil from cannabis. The difference is this. There's 15,000, I don't know how many different varieties of cannabis and hemp.
Yeah.
Some of the varieties have what they call a full spectrum terpene rich. Those will contain THC, CBD. Those are the only plants that will give you those 400 chemical interactions that we call the entourage effect that I spoke of. That's what you want. You don't want CBD isolate. CBD isolate has been stripped of all the other properties. And don't get me wrong, it's better than nothing, okay?
Okay.
And it works for a lot of people. But you lose the entourage effect if you do not have whole plant, full spectrum oil.
Okay, so folks, and Jay, correct me if I'm wrong, what I'm hearing is this. You have an acre of pain and you want to go to the store, go online and order some CBD ointment. You know, hopefully you get a good one and it doesn't have icky chemicals in it, and it might make a difference. However, let's go back to inflammation, that silent killer. Let's just say you're really sick, and maybe it's not just inflammation, it could even be worse. Now you should, what do they do? Do you go, if cannabis products are legal in your state, and I think I should say that because this is an international show, if it's legal where you live, then...
If it's not, find a hippie.
No, stop that. Stop
the hippies had it right.
But what do we do? Do you go to a dispensary? Do you go to, can I say the name of your company?
My company is Village Floor, and we're here at 99 High Tide in Malibu, California. And the reason I love this store so much is that they focus on healing. They focus on patient care. You know?
So we just like anything else, you don't just willy-nilly go take a medicine and hope it works.
Nah.
No, it's their job to do a little bit of research and find a good, healthy dispensary in their area
that focuses on healing, not just indica or sativa. And oh, by the way, we've got a CBD bottle here. No, you need someone that is centered on healing protocols and utilizing the medicine for its most powerful tool.
Okay, so let's just finish off this inflammation thing, because folks, if you're eating food and you get bloated and you get up the next day and you're still feeling kind of bloaty, inflammation. If you have certain nerve issues, inflammation, which by the way, if you get inflammation around the gut that presses on the aorta, now it's going to raise your blood pressure. Gosh, that's a lot of fun as we get older, isn't it? High blood pressure. Jay, don't worry about speaking over our heads. Just tell us what you've seen, and then we're going to wrap this up and go to the next interview where we talk more about this. What have you seen? You said that CBD in particular, but now we understand what you meant was proper ratio, right? Yeah. Medicine. You've actually seen inflammatory issues evaporate. So, of course, you won't mention any names, but give us just one idea. What have you seen?
Arthritis.
That's a good one.
When I told my father-in-law the truth about what I do for a living a couple of years ago. Oh. Yeah. He's very liberal, very intelligent, and very open-minded. So I wasn't too concerned, but yeah, it was, I wasn't comfortable. I don't like anything not on the table.
Of course.
And that week he was visiting, he'd woke up one day and he looked disheveled, and I said to him, "You okay?" He showed me his hands. He had two fingers. They were like sausages, and it's rheumatoid arthritis. There's nothing you can do for it. I've seen the doctors, and it's excellent medical care.
Okay.
And I gave him a bottle of CBD and a infused salve. Not highly infused. You want to take a base cream and add anywhere from 1 to 10% THC oil to that cream. Heck, you can just dump it in shea butter, for God's sake. In the salve, on the topical, you'll add THC. 1 to 10%. If 1% doesn't work, bump it up, maybe make it stronger.
Okay.
And then take CBD orally as a sublingual spray.
Okay.
It's the combination of CBD and THC, the 1-2 punch, that give you the entourage effect of this whole thing that works.
And if folks, again, we don't self-diagnose any more than we self-dose. Jay is an expert. All right,
yeah, but this is easy stuff anybody can do.
I get it. But for now, we just don't want a bunch of cowboys out there, just trying to make it up. All right, so tell us what happened with your father-in-law. This is a verifiable story.
Oh yeah, we can call. He answers the phone.
we won't, but we could. Okay.
And I instructed him to take a 10 milligram dose of CBD 3 or 4 times a day, under the tongue, sublingual, along with the cream on the sore, swollen fingers and joints. And within 20 minutes, he looked at me with a kind of a look of amazement on his face. And he looked me dead in the eye and he said, "I'm flabbergasted." And I said, "If you stick to the protocol and we increase the dosing gently over the weeks, I believe we can reduce your pain by 60, 70, 80%. At the end of the month, he called me and he said, "Jay, my pain is virtually gone." And that's why you hear so much popularity of CBD amongst seniors today.
Right.
Because there's nothing that you can take to relieve rheumatoid arthritis. Nothing out there.
No.
Nothing over the counter, nothing prescribed. This works. It's not a magic bullet going to work 100% of the time. But I promise you, if you dose it correctly, it'll work most of the time in areas that nothing else does. And that's why you're starting to see the popularity of CBD. It works. It's a great pain management tool. It's great anti-inflammatory.
So would you, gosh, so I'm going to ask one more question and then we're going to wrap this up and go to another, get ready for the next interview. Let's just say there's somebody in Minnesota. Minnesota is legal for medical.
Mm-hmm.
They go and they pick up, or even Colorado, and we go to the dispensary and we pick up a product, or we go online and we pick up a product and have it mailed to our state that says it's a CBD medicine.
Mm-hmm.
If they, and of course, listeners, the responsibility is on you. If you see propylene glycol and sodium lauryl sulfate, don't buy it. I mean, we assume you know to do that much, but if we try one medicine and it doesn't work, is it worth? I mean, just CBD stuff. Is it worth trying another one when we know it's not legal across the board to have the THC with the CBDs that you said we need in proper ratios?
Mm-hmm.
Should we just keep looking for another medicine, or do we have to accept that maybe we need a practitioner now? I mean, trying to give them something to do.
Yeah, no. What you want to look for is whole plant, full spectrum CBD medicine. Whether they call it cannabis oil, Rick Simpson oil, hemp oil. What you need is whole plant, full spectrum. That's what's critical. Okay,
listeners.
That's what's critical.
Write it down before you go shopping. That's what you're looking for.
Yep. Isolate. Look. Isolate works in a lot of cases.
Oh.
It does. It works. But it's not going to give you the highest percentage of possibility of working. You want that entourage effect. You want those 400 chemical interactions. That's where the magic lies. It doesn't give you the highest possibility of success to strip out components of the plant And that's what isolate does. By its own term, it's isolated. It's just the CBD cannabinoid. And there's value in that, don't get me wrong. I'm just a whole plant naturalist kind of guy.
Well, and let's go full circle. We started out the show talking about vitamin C.
Mm-hmm.
And you can just take vitamin C, and actually for a lot of people it's very helpful. But when you add the bioflavonoids, it becomes more bioavailable. Now listeners, we're going to do a show in a week or two or 4, I can't remember how this works. We're going to do a show where we're going to talk about bioavailability and why Jay's medicines are cutting edge, because they are very different. How he delivers the medicine to very sick people, actually. But yeah, let's go full circle with that. You can have an isolate and maybe you get a benefit. Woo! Listen to that. There's an emergency somewhere. Ow! Okay. You can get an isolate and you might get benefits, but don't stop there. If you're not getting your needs met, then look for your full spectrum medicine. And, it doesn't cost you anything just to send an email to Village Flora, ask a question, be patient. A lot of people are sending those emails, and it takes a while sometimes to get an answer. But we're actually hiring people as we speak just to try to
keep up.
All right, Jay, thank you so much, and I look forward to seeing you again in a couple weeks.
My pleasure. Thank you.
Bye, listeners.
Thank you for joining us on another Empowerment Through Knowledge adventure. Want to learn more? Find Master Chia at mantakchia.com. That's mantakchia.com. Find more medical Qigong lessons, books, and information about studying directly with Serena at serenastone.com. SarinAstone.com. Thanks for listening. If you like what you learned, subscribe today.